and then representative from Mandha from ICC Shillong, then Mandha IIDU.
Ka health camp ban ai jingsumar shaki Paidbah ban khmih bñiah ïaki briew kiba don ka jingpang HIV/AIDS Ha Ri Bhoi la sakhi ka jingwan shim bynta Kumba khat hajar spa prapho Ngut ki nongshong shnong ka Ri-Bhoi ban check up ïalade halor ki jat jingpang bapher haki spa prapho weitli ki kam ya kane ka health camp la tip kum ka integrated health campaign ka bala penlong da ka Meghalaya AIDS Control Society haka jinga trailang bat ka office u deputy commissioner bat ki weki tenat sorkar ya ka bala sedang nadu ka khat nyau tarik risau hajar phulai bala yo ban penkut no mentakas ngi khandai tarik u Kyllalyngkot hajar phusau ya kate ka integrated health campaign lawan ban penhap perdano mentakas ngi da uba Middlebourne CM chairman ka Meghalaya State Health Advisory Board jaka sorkar Jylla kumukongsan haka jingdan lang ka Dr. B Decruse Project Director ka Max Dr. L Myrthong Deputy Director Medical Max Dr. D Blah Additional DM&HO Ri-Bhoi District Dr. E Kyllalyngkot District AIDS Control Officer Ri-Bhoi District bat ki weki officer na kitanat sorkar bapher bat katanat ka kwat kia ha ketika sini na kalian ka Max kala yoru ban penku buram ya kitanat sorkar bapher ki doktor katanat ka kwat kia ki kenhun trimon ngobha ki balaya don benta na du basdang ketika health campaign kabla long ka ba Seisoh.
Prevention is always better than cure, and we have prioritized Ri-Bhoi over other districts for the second integrated health campaign in the state because of the following objectives. Ri-Bhoi is an aspirational district of Meghalaya, and it is sharing a long boundary with Assam, which is having a concentrated at-risk population. It also has the national highway connecting the gateway of Northeast India through Meghalaya to the Barak Valley in Assam, leading to other northeastern states which are having a higher prevalence like our state, that is Manipur, Mizoram, and it also leads to ultimately to Myanmar and the Golden Triangle. Ri-Bhoi also has a high mobility of daily wage laborers, commercial drivers because of the highway, and a number of factory workers working in the different industries present in this district. And we had also conducted the IHC to bring about awareness to the general population of Ri-Bhoi District. As Dr. Kyllalyngkot had mentioned, Ri-Bhoi has 515 PLHIVs, people living with HIV, but the loss to follow up is a great cause of concern, and the number stands at 99. A little bit on the concept of the integrated health campaign. This is a newer strategy by NACO to control, manage and contain the rising HIV and related infection within a short time period, that is 3 to 6 months. This was taken actually because in recent years the studies have shown that a large number of cases are actually from the unreached population, that is the partners of PLHIVs, injecting drug partners, and so on.
As per the report that has been placed and represent, we have seen not less than 23 HIV positive case has been detected so far in Ri-Bhoi District. Since the time we met in East Jait Hills in Cleria, which is one of the districts with a high rate of HIV positive within the state, even though Ri-Bhoi, it falls in the category as a low category, but you have taken an initiative to come because we know our district is a vulnerable area, vulnerable district. We share a porous border with Assam. We have a highway which connect 2 to 3 states within northeastern state. We have several industries We have 2 EPIP campus, one in Unyam, one in bñiah. We have quite a large number of laborers also who came from outside the state for different purposes that has been entrusted within this district. As we have seen in the past, the data that has been placed, it is quite alarming. There is a campaign, a mantra for say no to drugs, say no to tobacco, say no to plastic, and there are different initiatives that has been taken, not only by the health department, but by different stakeholders, NGOs, civil society, government missionaries, to eradicate many issues that are there within our society. And we are here today to witness this program on the closing ceremony. And I'm not wrong to say that it is a right time that each and every one of us, we have to come together to fight for this noble cause so that our future generation will be in the safe hand. I would like to place on record my sincere thanks, since most of us we are here, most of you are the health worker within the health department and other agencies which has been entrusted with different tasks. And we have seen that despite of many issues in and around us, but we are still fighting, and we keep on fighting in the days to come also. In the past 2 to 3 years when COVID was there, mostly the health workers are there at the ground to fight this epidemic. I would like to thank each and every one of you who are present here, not only from the health department or the line department, for the dedication that you have worked how to fight COVID-19 during those years.